Hi, good afternoon. I am Dr. Virender Gehlawat. I am consultant pediatrics and head pediatric ICU at Manipal Hospitals Dwarka. Today we will discuss why children are more vulnerable to the effect of pollution as compared to adult population. Because children breathe at a faster rate. Their respiratory rate is relatively high as compared to adult population. So the amount of air breathed in and breathed out is relatively high per kg body weight, which leads to the greater pollutant intake as compared to the adult population. Next, lung tissue is still developing. The lung growth, the alveolar development is continuous till the age of adolescence. And during this critical phase of lung development, if the lung is exposed to the pollution, which leads to a long-term impairment in the lung function and its structure. In children, the mucociliary clearance and the defense mechanism is still developing. So this immature mucociliary clearance and the immature defense mechanism is not able to neutralize or clear up the pollution. Children are very active. They spend more time in the outdoor activities, especially during the daytime when the pollution is very high, making them more vulnerable to the effect of pollution. Many pollutants are denser and they concentrate near the ground level where children play and breathe, making them more vulnerable to the effect of pollution. Children who are already suffering from some sort of allergies and asthma, during pollution days they experience more frequent episode and more severe exacerbation due to pollution triggered airway inflammation. These are the reasons why children are more vulnerable to the airway pollution as compared to the adult population. Next we will discuss what are the short-term and the long-term health issues among children during high pollution months. In short term, the most common organ affected is the respiratory system. Children encounter more frequent episodes of cough, sore throat, breathlessness, and they present with the wheezing, with the severe respiratory distress, more frequent visits to the OPD. During the pollution months, the allergic problems has worsened due to the particulate and the allergen interaction, especially the allergic rhinitis, the conjunctivitis, the eczema. Air pollution significantly affect the local lung immunity, which predispose the kids to the more number of respiratory infections, especially pneumonia, acute bronchiolitis. A lot of kids experience systemic symptoms during the highly polluted months like headache, fatigue, lack of appetite, poor concentration in the school. Now we'll discuss what are the long-term effects of the pollution on the body. First is the respiratory system. As we have already discussed, the lung is still in the growing phase. So during this critical growth phase, if the lung is constantly exposed to the high pollution, which significantly affect the structural part as well as the functional part of the lung. If there is constant exposure to the environmental pollution, certain illnesses like asthma, hyperactive airway disease can worsen over a period of time, and ultimately child can land up in the chronic respiratory disease. Constant environmental exposure can significantly affect the neurodevelopmental outcome of the pediatric population. Lots of studies are there which are showing those who are constantly exposed to the environmental pollution has poor scholastic performance, there are a lot of behavioral issues seen, and there is impaired cognition in that particular group. Pollution may skew the immune system, it can dysregulate the immune system and leads to allergic sensitization and increase the long-term burden of the allergy. Early exposure to the environmental pollution leads to the long-term effect like hypertension, the insulin resistance, and later in the life a lot of cardiovascular issues.